Hello, I'd like to welcome you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village, and also the co-host of It's About You on WGYC Channel 3, where I do a segment called Everyday Champions, where we're looking at people in the community who are doing great things. However, this segment, it's about you. Yes, it's about your health. I've partnered with university hospitals to make sure that all your questions are answered from all the experts in the medical field. And so today I'll be speaking with Dr. Luke Rothermel, who is an oncologist at university hospitals. Thank you so much for being on the segment with us today, Dr. Luke.
Thank you for having me. I really appreciate it.
Listen, I appreciate all that you're doing in the community and at university hospitals. So what's our topic for today?
Today's topic is skin cancer.
Skin cancer. Okay, so what is skin cancer? Let's just kind of get right to it.
Well, skin cancer consists of a group of cancers that start on the skin. It can be a number of different diagnoses, but many of these cancers grow and can cause deformities, things like squamous cell carcinoma or basal cell carcinomas. And certain skin cancers can also spread throughout the body. And that's cancers like melanoma or certain types of squamous cell carcinoma.
Wow. So how does this differ from other cancers?
It's a great question. Most cancers are detected because symptoms arise in a patient. They feel something that leads to an investigation, or an imaging test finds something that was unexpected, and further workup needs to be done. But skin cancers are often visible to us. As such, we're able to see our skin. We're able to look at the skins of our loved ones and see little lesions that may be changing or unusual. And that type of screening opportunity is how this differs. These are things that we ourselves can recognize, or we can recognize for the people that we love.
Gotcha. Who's at risk?
The major risk factor for most skin cancers is ultraviolet light exposure. And we are all exposed to UV rays that comes from the sun. It compounds over a lifetime of being out in the sun. Some of us get blistering sunburns when we're out there, and that type of exposure is something that can affect your skin and then lead to problems down the road. Now, as such, there are certain types of skin that are more at risk. And, certain cancers like squamous cell carcinoma are common in all skin types. And it's just time and age that leads to that risk being higher. But then there are other cancers like melanoma, for instance, that are far more common in lighter skinned individuals than in those with darker skin. But it needs to be understood that melanoma, which is the most aggressive skin cancer, still occurs in people with darker skin. But oftentimes it's in unsuspecting sites, like under a fingernail or a toenail, or even on the palms of the hands or soles of the feet. And then the last thing I'll tell you is skin cancers, they are much more common in patients that are under immunosuppression. And immunosuppression means they're on steroids, or maybe they're getting chemotherapy for another type of cancer, or they have a certain condition in which their immune system is not as robust to fight off foreign cells and these mutations that occur in cancers on the skin. And so when the immune system can't fight it, then skin cancers are fairly common in those populations.
Wow. Well, how can you tell from a good lesion or a bad lesion, on the skin?
So this is a challenge even for me. The reality is that this is a question that is very difficult to tell for most people, even me as a cancer surgeon that deals with skin lesions and skin cancers. I still rely heavily on my dermatology colleagues because they are trained to be able to answer that very question.
Okay.
However, how does somebody at home determine if they even need to see a dermatologist? I would say that a wound that you have on your arms, legs, anywhere on the body that isn't healing. Sometimes non-healing wounds are a marker of an underlying skin cancer. Other times, if you're looking at a mole or you're looking at a another type of pigmented lesion on the skin, we use criteria. One of them is called the ABCDE criteria, but we're looking for, is this an asymmetrical lesion? Are the borders irregular? Is the color irregular? Is the diameter bigger? And oftentimes we use 6 millimeters as a cutoff there. But E stands for, is it evolving? And what that means is it changing in any way? And I think that I would impress upon your audience that a changing lesion is the most common way that people like you and me find a skin cancer. And if you're noticing that there is a changing lesion, that's exactly when you should bring it to the attention of a physician.
Gotcha. What about large like areas of discoloration on certain parts of the body? A lot of people call
Yes.
them birthmarks and things like
Yes.
that. Are those topics for concern?
So that's a great question. What I would tell you about that is no, in general, having that is not a risk, and those are benign lesions that are just exactly what you described. They are birthmarks. They are part of our skin that is going to be that way for a lifetime. However, if you have a lesion like that is changing, that's when you go, this has been part of me, but there's part of this area that now looks different. And that's when you got to bring that to the attention of somebody.
Got you. So how do you treat cancer? How do you treat these areas?
Yes. So for skin cancers, this ranges all the way from taking a single lesion and either freezing it off or doing a surgical excision of that and treating that just by those local treatments, all the way up to a multidisciplinary approach where we involve things like chemotherapy or immunotherapy or radiation treatment in addition to surgery. And so it depends how early a skin cancer is caught. And that's the important thing about the ability to screen for this. If we catch an early skin cancer, the ability to manage that is great, and the prognosis is great. When these become more advanced, the treatments have to become more aggressive. And even though we have made great strides in how we can impact the lives of patients with advanced skin cancers, it is still better to catch these early and to have something done about it.
Got you. Earlier, the better. That's
Earlier,
what I'm learning here. Thank you so much, Doctor. So before we go, what do you want people to know about skin cancer?
Well, a lot of repeating of what I have said, but I think that screening for skin cancers, identifying lesions that might be changing, and bringing it to the attention of a physician like your primary care doctor or a dermatologist is key. Many times we are bringing things to their attention that aren't skin cancers, but when when we can find an early skin cancer, it is extraordinarily treatable, and it can give us many more options for giving patients a good prognosis.
Got
And
you.
this is something that you and me and all of the people listening can help to identify. And so screening for that, identifying changing lesions is so important.
Gotcha. So early screening is key. Thank you so much, Dr. Rothermel, for all that you do and for giving us all this information on skin cancer. And remember, to all of our viewers, make sure that you call university hospitals. Dr. Rothermel is available. And of course, I think he suggested you go to a dermatologist to look for the identification of it. And he is the surgeon that can make you well. Thanks again for being on the segment.
Thanks for having me. I appreciate the time.
Thank you. And I want to thank all of our viewers that are watching. Remember, you can contact me on social media, on Facebook and Instagram, or go to my website at larrymaconjr.com. Remember, good health is good wealth. And we're so thankful that University Hospitals is continuing to make people well and to help people out through their medical issues. Again, we'll see you on next week. Thanks again, Dr. Luke Rothermel.
Take care.